Well, good afternoon. Today is about supporting those who are supporting us. Supporting those on the front lines who are doing their part to keep our province running. Making great sacrifices to fight the people that are out there and supporting us day in and day out. Well, my friends, I'm going to be very frank. The screen went on me, so I'm going to go talk from the heart here. We are out there day in and day out, making sure that we support the frontline workers. And as we've seen before, nothing's more important to families than taking care of their children. And we're expanding the list today on the children, on who we're going to take care of and in childcare as well. So, my friends, we're supporting all the frontline workers in meatpacking companies, right across the board, in retail, grocery clerks that stand there day in and day out, making sure that they serve us as they go through the line. And my friends, we're going to continue working and making sure we keep families safe here in Ontario. The good news is we saw a trend. We saw a trend yesterday. It's a trend that actually has seen the needle start going southward. It's the lowest amount of cases we've seen over the last 3 weeks. And this is a positive trend to give people hope that we're getting close to opening up. I can't give you dates right now, but what I can give you is hope that we're getting closer. Day after day, when we see positive trends going down, we'll make sure that that's going to be closer to the day we open up. I want to thank you. I want to thank the frontline hardworking people of this great province, and we're going to continue supporting you. God bless the people of Ontario. I'll pass it over to Minister Lecce.
Well, good afternoon. Thank you all, and thank you, Premier. Every day, in virtually every way, workers on the front lines are making a difference in this province. They ensure our shelves are stocked and our families are fed. They care for our seniors and provide life-saving medicine to those that need it. They are our women and men in uniform who courageously serve to protect our people and our country. These are Canada's heroes in many ways, and they deserve all for our full support. The Premier made clear we must do whatever it takes to assist those on the front lines, to give them the relief they deserve as they work around the clock throughout the COVID-19 outbreak. We've unveiled a program, as many provinces have, to provide emergency childcare to those workers. Since we first unveiled that emergency childcare program on March 22nd, we've taken a staged, cautious, responsible approach to ensure safety remains paramount. And I'm proud that Ontario will support more frontline workers today by expanding that list of individuals who are eligible to receive emergency childcare in this province. And the list includes staff in grocery stores and pharmacies, those that work in retirement homes, Ontario truckers, the Canadian Armed Forces, and those that support Canadians who are deaf or hard of hearing. While we are expanding those that are eligible, we've heightened our strict health and safety protocols for those centres under the consultation of the local medical officer of health. This phased expansion is supported by the Chief Medical Officer of Health, knowing that we have put in place strict guidelines and protocols and that we have taken a zero-tolerance approach when it comes to keeping kids safe. Those guidelines ensure that no site could exceed 50 people, that these centres must be thoroughly cleaned every day before opening, that all staff must be screened before they enter the centre, that a plan is in place and supported by the local health authority should an outbreak occur, and that visitors are not permitted to enter the centre at all. Everyone is screened upon arrival, and everyone that has any sign or symptom is not permitted inside. Zero tolerance, folks. Now, as I conclude, I just want to thank our childcare workers and those operators working hard to support our frontline workers and for taking safety seriously. Thank you.
We'll go to the phone line for questions. First question.
First question comes from Robert Benzie from the Toronto Star. Please go ahead.
Hi, Robert.
Good afternoon, Premier. It was hoped we would see 19,000 COVID-19 tests a day by mid-April, but we are near the end of the month, and yesterday we didn't even crack 12,000. And I'm just wondering why this is continuing to lag, and what are the gaps that you feel still need to be filled?
Well, we increased testing drastically. I'll tell you, we had a little fallback yesterday to a little over 10,000, but majority of the days we're doing over 12,500. We're getting close to our point of 14,000. I know that will continue over the next week. We said by the end of the month we'll see a difference moving forward in May, and we will see a difference. We're going to make sure that we continue increasing the testing. I can't give you an exact answer, Robert, why they only had 10,500 yesterday, but I'll get that answer. They've been doing pretty good, actually. They've been doing over 12,000 every single day, so our goal is 14,000 in the beginning of May, which is over the next day or so, we'll see that increase.
So you were saying before, though, that you were really frustrated. This is 3 weeks ago, you were saying how frustrated you were. Are you still frustrated, or are you now satisfied that they're going in the right direction?
Well,
because it's still, I mean, we still have many tests that need to be done before we can reach some of the benchmarks that Dr. Williams has talked about for opening up the economy.
Well, I'm satisfied because I kept seeing the 12,500. Sure, they had a little dip yesterday. I understand that, but we'll get back onto it and make sure we're heading closer to the 14,000. But I'm confident they've really picked it up over the last few weeks, and they're doing an extremely good job. And we're going to be expanding tests as well to all the childcare centers and the workers over at the childcare. We have a very robust program when we screen these people when they come in, no matter if it's a parent or one of the childcare givers, they're going to be tested now.
Next question.
Next question comes from Allison Jones from the Canadian Press. Please go ahead.
Hi, Premier.
Hi.
I'm wondering if you've given any more thought to when childcare centers writ large are going to open. Are you looking at possibly opening them ahead of schools or ahead of some grades, as we've seen in other jurisdictions?
Well, I'm going to pass that over to the minister responsible for that. Thank you.
The government fully understands and recognizes that childcare is often a prerequisite for labor market participation. We want, as the economy comes on returns and we have a recovery, we want to see more people working, and therefore we need to ensure that childcare is accessible. So part of the broader recovery plan is very much considering that reality. Our commitment is to ensure that that every family is safe, that these children remain safe. And so every decision we make in the coming days and weeks to help support that economic recovery and individuals, particularly women entering the labor market, knowing that childcare is so important, the paramount decision point will be safety. But we appreciate the relationship between the two, and we'll be making those announcements in the coming weeks according to the recovery plan unveiled on Monday by Minister Phillips. That will help really guide us forward, but we definitely appreciate the importance of the economy. We know it is a prerequisite to get people back into the job market, and we hope to have a better finality on that once we get a better update on the modeling from the Chief Medical Officer of Health.
And a follow-up for you then, Minister Lecce. Does that mean that daycares will necessarily be included in stage one of the reopening? If you're reopening a large chunk of businesses, as you mentioned, the daycares would be a prerequisite for labor market participation.
It's a decision point that will come from the recovery chair, Minister Phillips. We are consulting the economy and our health experts. I understand, I think every member of this government understands how critical childcare is to getting our economy on track and how important those centers are to permitting parents and especially women entering the job market. We get that, and we will be able to report more on the details of each of those stages in the coming days, as Minister Phillips is already committed to doing.
Next question.
Next question comes from Brian Lilly from the Toronto Sun. Please go ahead.
Premier, your colleague Brian Pallister, the Premier of Manitoba, has just announced that May 4th they'll begin opening up. That's in line with neighboring Saskatchewan. Quebec is going to start shortly after that. Manitoba and Saskatchewan are not facing nearly the crisis that we are with COVID-19, but Quebec is in worse shape. They're all moving towards opening with dates, with details. Why do you still say that we shouldn't have details, that glimmer of hope that you say that people need, you're not willing to provide?
Well, we're providing a glimmer of hope every single day when we see the numbers and the trend go down. To the exception of a couple days ago, we're seeing the trend go down, so there is hope. And we're going to give people hope, but I'm not willing to roll the dice. And we aren't Quebec, and we aren't Manitoba and Saskatchewan. And I love the premiers, all three of them actually. They're doing an incredible job. But Saskatchewan has a couple of million people. We have 14.5 million people. We have an urban center of with the GTA over 6 million people. So I just ask people, they hang in there. We're seeing a trend. We're going to get there. There's going to be positive news if we continue on this trend. But over the next little while, you know, I can't just roll out dates. We're in a different situation than Saskatchewan and Manitoba and obviously Quebec too. But Brian, I'm just not going to chance it. We've worked so hard. We've come so far in this fight, and all of a sudden we're just going to start rolling it out. We're going to do it responsibly, thoughtfully, and cautiously, and we'll get there. And we'll get there hopefully sooner than later. But I'm feeling very positive about the results that we've seen over the last 4 or 5 days. If it continues, then we're going to be able to open up a lot sooner than we're hoping. And again, I'll tell you, Brian, no one wants to open up the economy more than I do, but we'll do it in a trickle, and we'll get it done. But let's just continue doing what we're doing, and we'll have some good news in a very short while.
For the private sector, though, Premier, that trickle that you're talking about for the sections of the economy that are closed down, that trickle means weeks or months of continued shutdown, depending on how things go, depending on what part of the economy they're in. A lot of business owners say they can't hold on. A lot of workers say they can't hold on, even with the federal support, and they're really struggling. In the meantime, you have not laid off a single public sector worker in the province of Ontario, nor, as far as I can tell, cut any hours. Aren't you creating two classes of citizens in the province of Ontario, those that are protected because they work for the government, and then the rest of the province that doesn't?
Well, let's be very clear. We have 60,000 employees here, and the government's still working. They're working remotely, but everyone's working. And I've asked that numerous times to deputy ministers, and it's not like people have their feet up outside with a margarita in their hands. They're working day in and day out. That's how the government continues to run. It wouldn't be able to run if everyone took their time off. So I just want to make sure that we continue moving forward, so when the time comes, we have a fully functional government that is continuing to run. And we're going to get there, Brian. I'm feeling confident, and hopefully it'll be sooner than later. But if we just do a knee-jerk reaction and just say, okay, we're opening up, that could backfire on us. And then where do we go? We go all the way back to the beginning again and start over again. Just folks, please, just have some patience. We're getting there. We're getting closer and closer, and hopefully very soon we're going to have some good news.
Next question.
Next question comes from Lisa Shing from CBC. Please go ahead.
Hi there, Premier.
Hi, Lisa.
Will the province still reopen if we don't get our testing capacity up, since a lot of experts are warning against opening until we have a better picture of the spread of the virus?
Well, we're doing, to the exception of yesterday, we're doing 12,500 tests every single day. I think now per capita we're only behind Alberta, and we're going to continue ramping up the testing up to 14,000 a day. That's our goal, and that's what we'll meet moving forward. And in May, we'll make sure we just increase the testing. We're focusing on two areas. Obviously, long-term care we're focusing on, but we're also, after what happened yesterday in childcare, a small incident in one of the places, I want all childcare workers tested as well. I want to protect our children. That's our #1 priority, make sure they're safe. And we're expanding the list of people and the essential service workers that are able to go to and bring their kids to childcare, just to give them a little bit of support, because they're working day in and day out. They're working their backs off.
Follow up?
And just following up on that, will the province still reopen, though, if we don't test for more, if we don't get to that 16,000, I think, by May 6th? Because a lot of experts say that if we don't have an accurate picture, then we don't have a good sense of how the virus is spreading in our community.
Well, that's our goal. When we said we were going to hit our first target, we hit our first target, and we're going to hit our target, 16,000 on May the 5th or 6th. We'll make sure we hit that target. We're working hard right across the province. That happens. But our main focus is obviously long-term care, testing as many people as possible there.
Next question.
Next question comes from Colin DeMello from CTV News. Please go ahead.
Hi there, good afternoon. I have a question for the Health Minister. Minister Elliott, so the province has been getting very detailed information on long-term care homes, the number of cases, deaths, and the number of homes that have seen a resolution in cases. But similar information pertaining to retirement homes isn't published. There's a similar median age, similar at-risk community as long-term care homes. Why is information on retirement homes not being published in the same way as long-term care homes?
Well, the focus has been on long-term care homes because of the outbreak in so many of the homes. The information is available with respect to retirement homes as well, and we can certainly publish that because I know that's another area of concern for people. But for long-term care homes, we are continuing to do the work there. We have had tremendous uptake with a number of hospitals that are prepared to partner with long-term care homes and send staff in. We have tested over 25% of all of the residents of long-term care homes now. We're going to continue to focus on that. There is a concern about retirement homes as well, but the focus right now has been on long-term care homes, also doing work in retirement homes, but we can certainly provide that information too.
Thank you, and I just have a follow-up for the Premier. Premier, I wanted to ask you about enforcement. So in the next few days, as the weather hopefully gets better, more people are going to want to go outside. We've heard some appalling stories of bylaw enforcement officers who have been ticketing, as an example, a mother who took her kids out for a walk, ticketed a father who's taken his autistic son to an empty field in Ottawa. Over the weekend, there were people protesting outside Queen's Park, yahoos, I believe you called them, yet not a single one of them were issued a ticket. I'm wondering what kind of a message does that send to the general public as we get closer to those warmer days? A protest is okay, but a walk in the park is a punishable offense. What kind of a message does that send?
Well, again, I don't direct the police. I can't tell the police. I can't pick up the phone, Travis, and call them up and say, oh, by the way, there's a bunch of yahoos, go find them. I can't do that. And no premier can do it, no mayor can do it. The police will determine if they're going to be ticketed or not. And sometimes you might get overzealous bylaw officers or police, but it's using good judgment. And I think the vast majority of our police use good judgment. I love our police, love our bylaw officers. Sounds like, they could have maybe used a little bit of different judgment on those couple calls, but again, they're doing an incredible job.
Last question.
The question comes from Julia Lamoureux from Radio Canada. Please go ahead.
Yes, good afternoon, Premier. Just to go back on the Quebec situation, they are reopening the economy sooner. The stores are going to be open in a few days also in most part of the province. Are you considering trying to control movements coming from Quebec to make sure it doesn't affect the situation here?
Well, we've said over and over again, I've mentioned it to Premier Legault, we don't want people right now coming across the border. I love Quebecers. I love people from Manitoba, but stay at home. And that same goes for the U.S. as well. Stay at home. It's nothing personal. We can't afford the spread of this virus here in Ontario. We're doing so well. So I'll emphasize it again. If you don't live in Ontario, stay at home. When this is over, we welcome you in open arms, but we just can't risk it. So again, I emphasize to the people that don't live in Ontario, we welcome you at another time, but we just can't have you into our province at this point.
But as a follow-up, how do you explain such a difference in the approaches between Premier Legault and yourself, given that their numbers are officially worse than ours?
Well, again, that's the Premier's decision in Quebec. And I respect, Premier Legault. He's a great leader. He's a great Premier, and he's a good friend. And, I don't want to comment him versus us. We're two different scenarios. And he's going to see if it works in his province, and I wish him all the best. I hope it does work. But we're in a different scenario here in Ontario. And again, I'm not going to risk people's health and well-being of this province over whatever it might be, maybe a few weeks, a month, or whatever it might be. But I can tell you one thing, the trend's going in the right direction because of all the great work the 14.5 million people are doing. It'd be a disaster if we just pull the trigger and open up the economy today and something goes wrong, and all of a sudden we see a spike. You'll be asking me different questions if that happens, and I'm not going to risk, again, the people's health in Ontario. We'll do it in a methodical way, a responsible way, and a thoughtful way. And when we get there, and hopefully it'll be sooner than later because the trend's going the right way, then we'll get the economy going. And when we get the economy going, there's one thing I'm confident about. We did it before, we'll do it again. We'll have this economy just humming. We will be the engine of Canada once again. I have all the confidence in the world in the people in Ontario, their ingenuity, their strength, their resilience. They're amazing people. And we're all working together. We'll get it going. And once we turn it on, watch out. We'll turn it on.
Thank you.
Okay. Thank you, everyone.